Good evening, everyone, and welcome to the Masters of Public Health webinar. We have a great webinar planned for you today with a quick overview of the course you'll need, and then we'll have the opportunity to hear from Dr. Kate Kennett in the Western Sydney Local Health District. Before we get started, I'll introduce myself. My name's Jack, and I am a current third-year student of the Doctor of Physiotherapy here at Macquarie University. And what we're looking at to do today is give you a snapshot of the Masters of Public Health, and we'll showcase the career options, explore future opportunities and the pathways to various career trajectories. Before we start, I would like to acknowledge the traditional owners and custodians of the country throughout Australia and their continuing connection to land, waters and community. We pay our respect to them and their cultures and elders past, present and future. Now, I would like to introduce Professor Janaki Amin, Course Director of the Masters of Public Health, the Head of Department of Health Systems and Populations, who will be providing an overview of the course. We'll then welcome special guest Dr. Kate Kenneth from the Western Sydney Local Health District. She'll be joining us to talk about her own personal journey and experiences. We'll then open it up to questions and answers throughout the Q&A. Now over to you, Janaki.
Hi, thank you, Jack. And welcome to everybody who's on the Zoom tonight. My name is Janaki Amin, and as Jack said, I'm the Director of the Master of Public Health course at Macquarie University. So just to tell you a little bit about me, I'm an infectious diseases epidemiologist. Once upon a time, I would have had to explain to you what that is, but I think most people are now well aware what an infectious diseases epidemiologist is. I look at the relationship of infectious diseases in populations and look at ways that we can control infection and the effects of infections. So exactly what you're seeing on the news around COVID most of the nights these days. But public health is something much broader than that. And I'll like to tell you a little bit about what our public health masters at Macquarie University looks like. So when you do the Masters of Public Health at Macquarie University, the Masters of Public Health at Macquarie University is very much an interdisciplinary course. Public health is an interdisciplinary field of endeavour. You could be a policy analyst, an epidemiologist, work in biostatistics or health promotion. These are all different areas of public health. So the way public health at Macquarie works is to expose you to all the facets of public health, at least at an introductory level, and then give you the opportunity to go more in depth into the areas that are of interest to you. It's very much a skills-based program, so the program has been developed in line with the Australian Schools of Public Health Capacity Building and Capabilities Guidelines, and it's also built looking at the United States and European guidelines for capabilities for public health practitioners. It's quite a new course. It was commenced in 2017, so all the materials are fresh. They're very much current public health. So in terms of what we teach, the content and how we teach it. So as I said, it's very skills-based. We also went to employers to find out what key skills they wanted from practitioners in public health. And we've designed the delivery of the course as well as the assessments in the course to align with the skills that would be expected of you once you're in the workplace. So what you will be learning when you do a Masters of Public Health with us is we ensure that everybody gets the fundamentals of public health. You won't leave the course wondering if there's something essential you've missed out on, because we make sure that that's covered in the core units of the course. These are the foundations in public health, epidemiology and statistics, the determinants of health, so what factors influence a population's ability to be healthy or are detrimental to their health, health law and economics, health promotion and health systems. And the focus of health systems within our course comes from our relationship with the Australian Institute of Health Innovation, which is also located at Macquarie University. And this is one of our key points of difference from other universities, this integration of the health systems and health systems science into the course. We also have electives that are taught from within the department, which include information technology, another key component of our degree that is quite unique to the Masters of Public Health at Macquarie University. Leadership, teamwork and advocacy. We also have new specialist elective units in infectious diseases, inclusive health, which looks at the health of marginalised populations, program planning and evaluation in health promotion, and global nutrition and food security. So you can see very much covering the topics that are key points in public health today. We also pride ourselves on the interfaculty relationships in delivering our course. So where there are key personnel with expertise across the university, we look into those units for those electives to be taught by those experts. And within Macquarie, those experts are in the fields of global health, leadership, and environmental health. So the course structure for the Masters of Public Health at Macquarie is that you can do 2 years of coursework, where the first year is the core and the second year is elective units, or you could do 1 year of research in your second year. This is a really intensive research year. You get to choose your topic of research in alignment with a supervisor who has skills in that area. It's a full embedded 1 year course, the research component, which enables you to be eligible to progress into a PhD if that's what you desire. It also just gives you a taste of what research is, a very authentic taste of what research is, so that you can decide whether this is an area that you would like to progress into, or you might want to be a practitioner, or you might want to integrate both of those components into your public health practice. So currently we have students who are doing the research component within the department, which is Health Systems and Populations. Like I said, we have a very close relationship with AIHI, the Australian Institute of Health Innovation. They also take our research students. We're also very closely aligned to Macquarie University Hospital, and they have a number of especially outpatient clinics and system service units, and there are students who are doing their research components with them. We also have partnerships with the wider public health network, including the Red Cross, the Cancer Council, and as you'll hear in a little bit, with Western Sydney Local Health District, but with a number of health districts and with the Department of Health. So there's the possibility to arrange for research opportunities in a variety of fields in public health. The third option when studying the Masters of Public Health is professional practice. Now at Macquarie, we offer a fully integrated internship semester. So it's a whole session, that's 10 weeks of full-time integration into a public health workplace. So to be eligible for both the professional practice and the research streams, you have to perform well in your first year of education, and then you can select if you want to go into the research or the professional practice stream. Again, there's diverse placements that you may choose to go to for the professional practice, including again AIHI, Macquarie Hospital, within the department, within local health districts. We have a very strong relationship with the Public Health Network as well, and we have students working there, and at the Cancer Council. So they're just a few of the places we have. We have quite a wide range of placement opportunities. Students get to nominate where they'd like to go, and we try and align the skill set and the desire of students with the placement options. Students can also come to us and say that there's somewhere they'd like to work, and we can try and line up an opportunity as well. So they're the three main pathways for a Macquarie University Masters of Public Health: a complete coursework degree, a degree with research or a degree with professional practice. And of course, because the professional practice is one session, you still get to do additional elective units as well. So we have a diverse course. We make sure you embed the core competencies of being a public health practitioner while allowing you to explore your own personal interests and to then enact those interests in either professional practice or research as well. So having said all of that, one of the key things that we really want to do is ensure that you're employable when you finish this course. And that's one of the reasons that we have invited Kate Kennett to come and speak to us this afternoon as well. Kate is from Western Sydney Local Health District, and she is one of the mentors for our professional practice placements as well. She's taken a number of our students. Hi,
hello,
Kate.
how are you all?
Welcome.
Thank you.
So, as I was saying, Kate is one of the supervisors for professional practice. Kate, could you tell us a little bit about what your role is at Western Sydney Local Health District?
So I'm the coordinator for the tobacco control program within health promotion, which is part of the Centre for Population Health at Western Sydney LHD.
Excellent. And have you been there very long?
I've been there for 3.5 years now.
Okay, almost as long as our course has been running.
Yeah.
And what's a day-to-day life in working in the local health district look like for you?
Well, there's pre-COVID life and COVID life for all of us in the local health district. But in terms of my population health role in working in tobacco control, our work involves a whole range of different types of strategies. So one of the big pieces of work that we do is building the capacity of our clinical colleagues to do more work around tobacco control and smoking cessation with their patients. So that could involve, for example, at the moment I'm doing a lot of work with all of our antenatal care services to implement a new stillbirth prevention program that involves, of course, quitting smoking in pregnancy. So that involves a lot of work with all the midwives and the obstetricians around training, resource development, developing protocols, and analysing their data to see what our performance is like. We do a similar type of work with our mental health services, because we know that people with mental illness have much higher rates of smoking and consequently more chronic disease. So we try to do a lot of work with our mental health services about building their ability to create more of a smoke-free environment and help patients who want to quit to quit. So that's one series of work that we have, and we do it similarly with a range of all of our other clinical colleagues as well. So, for example, working with youth health, supporting respiratory health, all of our clinical colleagues. So that's one area of work. And then I suppose another big area of work is then the community level work that we do. So working with particularly higher needs groups. So as we know, smoking is very much a reflector of the social determinants of health, with higher smoking rates amongst more disadvantaged communities, whether that's economically or minority groups. So for example, we've had recent campaigns around promoting smoke-free homes with Aboriginal people, and so that was about engaging our Aboriginal colleagues and community members to design a campaign and creating innovative, funny stories and promoting them on social media and through local organisations. We're part of a campaign at the moment called Shisha No Thanks, which is about raising the awareness, particularly amongst Arabic speaking communities, but everyone, that there are real health harms associated with smoking shisha or water pipe tobacco. So there are a few of the examples of the work we do.
That's awesome, and reflects the diversity of all the skill sets that you need in working in public health. So when you have something like COVID happen, not that any of us know something like COVID until it actually happened, what did that mean in terms of your workplace, and how did it affect you and your work?
Well, I would say that us in the public health unit were the first to start working from home, because our directors obviously knew exactly what was coming and what it meant and what we needed to do. So we were out of there really quickly. Then, apart from the working from home that everyone's doing, it was really about totally surge capacity and pivoting on the work we were doing and utilising the skills we have to somehow contribute to the effort to reduce the spread of COVID and the impact in the community. So for me, I've had 2 COVID roles. One is that I've been part of the contact tracing team. So a couple of days a week, I go into the office and we receive the notifications of people who are diagnosed with COVID, and we get allocated the cases, and we're the first ones to call them and to do the case interview with them, which means finding out how they're going, how they're feeling, what their symptoms are, what their background health might be, if they're in a high risk group or not, and then really exploring where they came into contact with COVID, how they contracted it, and then who they've been in contact with, where they might have spread it, and then talking them through how we're going to look after them during this time that they have COVID and what they need to do next. Awesome. So that's been one role. And then the other role that's been big for us in health promotion is around community communications about COVID. So getting the message out broadly to all the key community groups. And I suppose I've been involved in writing some content for our community website about COVID testing and prevention, but also wellbeing for the community at this time.
Some very busy role indeed, and I think really does reflect all the diversity of things that you need to know about to work in as an effective person in public health. You've mentioned determinants of health, infectious diseases, advocacy, communication, and I think as you look through our course, you'll see that all of those things are covered. And we have assessment types like doing podcasts and creating videos and writing evaluation plans, which are all things that Kate has mentioned as well. So I think the other thing that our prospective students might want to hear about is in terms of the professional practice, what was your role and how did you connect with the students that you've had from Macquarie University?
Well, I suppose I can talk about the student I've got right at the moment working with us, and she's doing a hybrid COVID tobacco control project for us at the moment. We've tasked her to really do the deep dive into all the emergent literature on how smoking and COVID are connected, because you might have heard there's been a lot of contradictory messages. Some people saying, you know, smoking makes COVID worse, other people saying smoking makes COVID better. So we've tasked her with tracking all that new evidence that's coming out daily to find out what we do know is the case, and then turning that scientific evidence into messages that we can share with the community. And so she's doing some work around creating some cartoon videos. She's writing a poll and some content that we can put on our website and through our social media sources to give people some more advice to make decisions about what's best for their health at the moment and how we can help them to quit smoking.
And how have you found it in terms of the skills that she's come to you with that help her complete that project?
You know, one of the things that I found all the Macquarie students say is, you know, I'll show them something, we'll go through something, often quite theoretical and pure health promotion practice. And they'll come back and say, yes, we've learnt that at uni and it's really great to see it actually in practice, and then they'll go off and do it. For us. So I see that they've got all the key learnings, and then they come with us ready to work and ready to put all those skills into practice. So I do find that they're employable now, and so just that real ability to apply the theory when they get the chance with our service.
Awesome, that's great. So I think we might go back to Jack and see if there's any questions for us in relation to the course and the placements and public health in general.
Perfect. We've got one currently. This one's for you, Kate, from Lynn. What led you to work in the public health industry?
Well, my first degree was in podiatry. So I started work straight away as a 21-year-old in a regional town that had a high Aboriginal population, and we also did a lot of work with the Royal Flying Doctors out to very remote centres. And I suppose there's two things about that lead you to public health. The first is when you're working in rural podiatry, you see so much diabetes, so many people for diabetes foot assessments. And in that particular town, we had an awful lot of clients with diabetic foot ulcers and who had had amputations of their lower limb. So that gets you thinking about how on earth can we prevent this from happening? What are the steps that we can do earlier so that people are not in this place where they're, you know, a lot of pain with non-healing wounds or losing their legs. And then the other aspect of that was when you leave the city and live in a very different environment, both socially, economically, and the environment, the access, you do start to get a real appreciation of the social determinants of health that, you know, when you're living in the same place and being able to buy the same food, you don't just blame behaviour on someone's poor health outcomes. So those sorts of things definitely started me thinking about what more can we do to promote community health other than treating each patient and each patient. So that's why I did my master's in public health. And then I suppose the thing that really changed it for me was being offered a chance to go work with the WHO in the Pacific as an Australian Youth Ambassador. That's something my university offered to me. So that's what set me off in public health.
Perfect. That sounds like a great path, I think. And we were talking before the webinar about how common it is for allied health professionals to go into public health afterwards. What are some qualities or desirable attributes you see in these allied health professionals that tend to lend well into public health?
There's lots of things, but a couple that I have found really important for myself and I see in my colleagues is firstly the critical thinking, clinical reasoning skills. So for us as allied health professionals, it's our job to assess a patient, to diagnose that patient, to work with them on their treatment and to follow it through that they get there. So they're the core skills of identifying a public health problem and solving it. So that clinical reasoning turning into critical analysis skills is really important. And then I think the other one is when you're an allied health professional, you really do build skills at engagement with your patient. So listening to their story and communicating with them. And that can obviously be applied then to broader community engagement. So I think they're pretty good core skills from most clinicians, but especially allied health.
We also get a lot of people who come from allied health or clinical backgrounds who talk about wanting to expand their reach. So going from working with individual people to impacting on entire communities or populations, which is what public health allows you to do.
Definitely, because if you're seeing the same problem over and over again, your mind drifts to can you prevent that? So yeah.
I think that's a great answer. Next one again is for you, Kate. Given the impact of the pandemic globally, has the role of public health professionals changed? And are there any new skills you expect to see from graduates?
What's really changed for us is that we're using our skills in a much broader range than our original job description, and we're understanding that we do have these core basic skills that we can apply in new scenarios. So we can learn new things quickly and use what abilities we do have and what practices we do have to the new scenario. So that's the biggest change. The other change that's been really obvious is that everyone is working together so much more. So across disciplines, across parts of the health service, we're all collaborating a lot more because we have to get it done and get the message out to the community. So, you know, for example, obviously the hospitals are collaborating with public health, who's collaborating with community health nurses, who's collaborating with Aboriginal health and multicultural health, and yeah, everyone is working together a lot more.
That's great. That's really good to hear. And for you, Janaki, are there any skills that you expect graduates will have that may have changed because of the pandemic?
I think a lot of what Kate said is really important, like the ability, the skill to actually work in teams and to work across diversity is really important. We have students often very early on in the course struggle with the amount of group work, and it's certainly not all group work, but it's there, and you can see Jack nodding. It's something that is happening in all courses everywhere, and the reason for that is an effective workplace needs people to work in teams, and we get better outcomes when we actually share ideas. So as Kate was saying, it's not necessarily new skills, but really using your diversity of skills that's going to become really important. Having said that, it's quite interesting to me. Traditional public health is about epidemiology, and it grew from infectious diseases, and they're the skills. So in some ways, we're actually going back to our old skills and making sure that they're applied in a very new setting. So it is about having the depth of knowledge that's really important. Also, having said that, there's so many new technological functions that are being rolled out to manage this epidemic, and in lots of different settings in public health as well. But we need to be really savvy about maintaining something that's very critical to public health, and that is critical thinking, like Kate suggested as well. But critical analysis and evaluation are core skills of public health, and no matter what interventions or other techniques we're applying, they're fundamental to our practice to make sure that what we're doing actually works.
Without a doubt, I think that's a really good point there.
Yeah.
It is that adaptation of skills we did have and putting them into the environments that do come up, which is across the board in healthcare, I think.
Yeah.
Next one for you, Janaki, again. What opportunities are there to work within or with Macquarie Uni Hospital?
So we've had a number of placements in both the professional practice as well as the research stream across into Macquarie Hospital. And we have people who are working in the hospital also be educators within the course. And you've seen that in the physiotherapy department as well. So across the health faculty, there's a lot of integration, and Macquarie University Hospital gives us a lot of opportunity to see how things work in practice. Also remembering a lot of public health is keeping people out of hospitals. So we work with a lot of the health sector in identifying where people are going and why they're developing or progressing to higher levels of illness, and how we can intervene so that that doesn't have to happen. But then once they are in hospitals, we can also work within clinical trials and within the context of hospitals to look at public health interventions as well.
Okay. Next one I have probably goes to both of you. Is the public health industry going to grow in the future? What if there's no pandemic next year?
We're all hoping there's no pandemic next year, but I don't think that's going to be the case. And if there's no COVID pandemic, there's still a lot of work that we still need to do in public health. As Kate mentioned, she's working in tobacco control. The detrimental health effects of tobacco have been known for decades now, and we're still working at ways to minimise the impacts on people's health with regards to tobacco. We are becoming more and more aware of the gradients of determinants of health, which Kate spoke about as well. None of that is going away soon. we've certainly seen the impacts of how infectious diseases can impact aged care. Aged care settings are going to be around for a very long time, and how we manage the health of the elderly, how we create environments for healthy aging is going to be really important. And on the other end of that spectrum is how we look after the very young, how we create systems and environments to ensure that people are given the best opportunities from the beginning of their lives and even before they're born prenatally. How do we create environments to support mothers bearing children and ensuring the best start in life for children as well, and then making sure they go through a healthy adolescence, adulthood, and then aging. So there's very much a life course approach to public health, and I don't think that the need for public health practitioners is going to disappear anytime soon.
Yeah, I mean, I think we've all heard a lot in the news about how wonderful the New South Wales health contact tracing has been as the gold standard across the country. And it's actually the reason why I moved to Sydney to work here in this system, because we have public health units in every local health district across the state, with all these opportunities, whether it's in immunisation or environmental health or a whole range of health promotion topics, as well as infectious disease. And what I'm interested to see is if the other states now replicate what we have. So if more public health jobs pop up around the country to try and have the robust system that New South Wales Health has. So most of us in the public health unit, so there's about 40 of us in the team. So we have 5 in the infectious disease team normally, and the rest of us all have other jobs that we do in the public health. And we've all just surged to infectious diseases during COVID, but we've all got our normal jobs to go back to when the pandemic is over. So I'm hopeful there will be a bigger range of public health jobs all around the country, both to address the existing public health issues, but to be ready for pandemics as well.
Yeah, that's definitely some good points there. Next one's for you, Janaki. How will COVID affect the teaching and delivery in 2021?
Okay, so we've learnt a lot in the last 8 months about how to deliver teaching, and our students have learnt a lot and taught us a lot about how they like to learn as well. So I think while there was a lot of concern and anxiety around flipping to online learning, especially early in the pandemic, we have learnt about synchronous online learning, which is where you do exactly what we're doing now. So we're at a distance, but we're still able to interact. We're still able to hear your questions, and you're still able to see who we are and respond to the information that we're exchanging with you. So this is quite a new format of teaching, and in some ways it's actually more effective. Our students have reduced travel time. They can engage in a different way that they have before. They're still getting interaction. And as you'll see at the end of this, you can get a recording of the whole event. You can get transcripts in terms of accessibility for people who have difficulties coming onto the campus or have a hearing or vision impaired. All of these mechanisms actually make our education more inclusive. Also, for Macquarie, we've taken the initiative to endeavour to provide face-to-face opportunities in small groups that are socially distanced and are safe as well, so that there are opportunities for tutorials to take place in a face-to-face fashion. So we separate some of the learning material into that more didactic information that might be provided online with interactive activities. We'll have interactive Zoom activities similar to what we're doing here. You might have some pre-recorded lectures, and then you'll also have the opportunity for face-to-face tutorials. But actually, Jack can probably tell you a bit more about what learning in a pandemic looks like.
It's definitely been different, but I think as you said, everyone's learnt a lot over the last 6-8 months about that online teaching. So I definitely can't discredit the value of face-to-face learning, especially in a hands-on degree like mine, but the face-to-face delivery online has actually been quite helpful, having that synchronous learning style and being able to talk, have those questions on the spot, have that conversation, have that interaction, really does make it like you are there having that discussion in person. So it is definitely helpful. And I don't think it has subsided too much from our normal life. And being someone who does travel quite a bit to go to uni, no travel time has made life a lot easier at times. So I can definitely vouch for that one there. The next question I have is, what's the difference between MQ's program and USyd's offering?
Okay, so I can't speak in detail about USyd's offering. A lot of curricula are changing at the moment. So I can talk about what, from the beginning of the year, what it kind of looked like and what the offerings are. The main difference that you will find is, to my knowledge, USyd does not offer the 6-month placement option, which is the 10 weeks embedded placement option, and it doesn't offer the research year. So I think it might look like a shorter course in terms of the length of the course, but it doesn't give you those opportunities to do the in-depth 1 year, full year of research, or the 10-week placement opportunity.
Perfect, thank you. The next one I have, in terms of placements, what kind of roles are offered during placements and what do they entail?
So it very much depends on where your placement is. I think I'll get Kate to just give a little bit of an update as to the types of roles she's had at her workplace. But we do have a different diversity of workplaces. Some may be more quantitative, some may be around advocacy or policy. They can be involved in systematic reviews. So very much dependent on where you are. But one of the reasons that we have the long-term placement opportunity is to give you a real sense of what it's like to be in the workplace. So you are there every day, 35 hours a week for 10 weeks. So you get an immersion into what it's like to be doing public health. And you also, you will feel like you have contributed by the end. It's not like you're sitting on the periphery and you're just watching what other people are doing. You are actually performing a role that is required by the place that, by your workplace. So you're contributing to the public health effort while you're in that workplace. So Kate, maybe you'd like to give us a bit more description of what it's like in your placements.
Yeah, so what we do in our team is we look to see if there's a piece of work, a project that we haven't got a chance to get to or we need some help with. So, and then we put that forward to the university as an option that students can choose. So we definitely look for something that we need done, something that's at our level of work that's going to contribute to tobacco control in Western Sydney and that utilises core health promotion practice skills. So at the moment, as I said, we've got someone working on smoking and COVID. We've had people in the past look at how we can use Google and social media to monitor health trends, with the example there being around shisha use and its growing use in the community. I know our infectious disease team has had one of your students before to work on a rheumatic heart disease project because we're having higher rates in our Pacific Islander communities as well as Aboriginal communities, and it's a completely preventable disease. So we look for projects that we need doing and see if there's a Macquarie student willing to come and work with us. So they'll have their own project role as well as being a member of our team and getting to observe what happens around them and the work that everyone else does as well.
Perfect. I think that definitely answers the question, what different placements you can get options for. The next question I've got probably more for you, Janaki. Is it common for students to arrive at the Masters of Public Health with an interest but without any background in health at all? And if so, can you give any examples of what sort of students you've seen like that?
It absolutely is. You don't have to have a health background to come into the Masters of Public Health, which is why we have our foundations unit right at the beginning. We have had students who have come from arts, who've been journalists, who have been educators, so a diversity of placements, a diversity of undergraduate degrees before coming to a Masters of Public Health. And it's a generalist master's degree, so we will be sharing with you our knowledge. We very much look at the course as an interactive two-way stream of learning, so you'll be learning from your other classmates as well as from your educators, so you will gain from their experience. But as long as you have the ability to do, as Kate described before, if you can think critically and if you can synthesize information, you can do a Masters in Public Health.
Yeah, I think that's a really good point there. You mentioned as well earlier about competitive selections for placements. What happens if you don't meet those requirements?
So you can still do the coursework opportunity for the second year of study. And like I said, there's a diversity of options there from within the faculty as well as across faculty. So if you have an interest in environmental health or global health or leadership, there's a selection of units that you can study then into that second year. The requirements are for the professional practice, you need to have about a credit average to be eligible. And then you also have to create a CV and go through an interview process. So it's very much to build that real world experience of what it's like to apply for a job. And that's the pathway for the professional practice. For the research year, you need to have demonstrated some research skills. So you need to have achieved a distinction in either the epidemiology unit or the applied research methods unit.
In addition to that, once international borders are open, will be the opportunities for international placements?
So we haven't done international placements, but we have done international curriculum studying change. I didn't describe that very well. You can go overseas to do a semester of study. So we've had we've had a few students. Some have gone to the States, some have gone to the Netherlands, and I think we had one go to Sweden as well. So you can do international study in terms of your coursework components.
Perfect. Well, that's all the questions we have currently. And if there's no more, we might wrap up there. We'll give it a second, see if there's any questions that pop up last minute. If there is any questions that anyone has that haven't been answered and you think of them after, you can book in for a personalized one-on-one consultation. We can get those questions answered for you as well. And what you'll see here is a link to go to book those personalized consultations. So if you do have those questions, feel free to contact us. And I'm going to say a big thank you to both of you for joining us today for the Public Health webinar. And also thanks to all of you for listening and joining us today as well.